female reproductive system is a thing of wonder. Of course, the uterus is the muscular organ that is going to receive the embryo and keep it flourishing during embryonic and fetal development prior to birth. It does have 3 layers. Follows a pattern that we've seen before, where there is going to be a deep epithelial layer that's known as the endometrium. That is where the blastocyte will implant. The myometrium, remember, myo always means muscle. Myometrium will be thick bundles of smooth muscle. It's the bulk of the uterus, and you're going to need that for labor and delivery. And then, of course, there will be a visceral covering, which will, no surprise, be connective tissue, which is going to provide a site for anchoring as well as protection of the underlying tissues. That is known as the perimetrium. The uterus is not too terribly big. It's about 3 inches in height and about 2 inches wide. However, with pregnancy, it can grow up to 20 times that size. So really, that is a remarkable fact about the uterus. Of course, it's going to provide mechanical protection for the developing embryo and then the fetus. The embryo is a cluster of cells, considered the embryo until about 8 weeks of age. After 8 weeks, it's considered a fetus. The walls of the uterus will also provide nutritional support and the ability to remove wastes for that developing embryo and fetus. Several good videos, anything done by the Institute of Human Anatomy, I find fascinating. So make sure that you watch those. Interestingly, the embryo arises in fetal development from 2 small tubes that will merge to form one. On occasion, I think if I remember correctly, it's sort of 1 out of every 2,000 women that single organ does not arise and the woman will end up with 2 smaller uteri. That condition, if I remember correctly, is called didelphys. I believe it's called didelphys. Yes, a woman can carry 2 separate infants in, 1 in each of the uteri if they have didelphys, and the fetus can develop normally. I think that happens 1 out of every 25,000 times in women with didelphys, so that's pretty rare. Didelphys itself is pretty rare, and that is even more rare. It is something that needs to be considered if infertility is an issue and or the female continues to have multiple miscarriages for no apparent reason, no clear reason. It can only be determined via imaging. The ovaries, of course, are the primary sex organs for the female, sort of held near the lateral walls of the pelvic cavity. You know, I'm big about you guys knowing functions, so know them. They are responsible for the production of the oocytes, which are those immature female gametes. They will also be responsible for secretion of both estrogen and progesterone, which are the super important female sex hormones. They will also produce a hormone that will inhibit the production of follicle stimulating hormone by the adenohypophysis, that is known as inhibin. So, you know the functions. I'm all about functions and you guys knowing them. The internal structure is similar to one we've seen before. There will be a deeper medulla. That is where the connective tissue, blood vessels, lymph vessels, and nerves will live. Those are all about nourishment and support for the ovary. The cortex is where the ovarian follicles will be found, and they're going to be covered by what's known as germinal epithelium. That is going to be a layer of either squamous or cuboidal epithelial cells, and that they will be continuous with the visceral peritoneum. That's the innermost layer of the peritoneum. The tunica albuginea is dense connective tissue layer that is going to be just deep to that germinal epithelium. Of course, we know that the interior ovary is divided into the cortex, which is where the oocytes are produced, and then the medulla, which is deep to that, which is all about support, waste removal. And there you have it. That's what it looks like. And that is a micrograph. We do have various ligaments and connective tissues which are going to help support and stabilize the ovaries. The ovarian ligament, the suspensory ligament, the broad ligament. Those are all going to be responsible for stabilizing and supporting the ovaries. The mesovarium is a fold of the mesentery, hence its name mesovarium. And that is also going to support and stabilize the ovaries. And that shows you what's happening. You can see the ureters here and here, which are tucked in from behind that very large wing-like broad ligament. Fallopian tubes, or the uterine tubes, are also a thing of amazing beauty, or things, because there are a pair of them. They're bilateral. They are only about, if I remember correctly, I think they're about 12 centimeters long, which is only about 4.5 inches, slightly greater than 4.5 inches if I'm doing a math right quickly in my head. You will notice, oh, also, this is another fun fact, I still not a need to know, they only have the diameter of about a sewing needle, so they are teensy. The distal ends are going to expand into what are known as fimbriae, which will help expand over the ovary. And the reason for that is because you want the ovum to be moving right into the uterine tube once it's released. The inner lining of the fallopian tubes covered with cilia. What does cilia do? It moves material across the surface of a membrane. So sure enough, in this case, cilia is going to assist with the movement of the oocyte, because that oocyte gets swept along the surface of the membrane by cilia. Typically, when fertilization occurs, it will occur within the fallopian tubes, and then the fertilized egg will move down into the uterus and implant in the endometrium. Can be problems if implantation actually happens within the uterine tube and cause severe problems for the female if that happens. The lower portion of the uterus is going to narrow and skinny down to form the cervix, which is the opening between the vagina and the uterus. The opening that connects the uterine cavity to the actual cervical canal is known as the internal os. If there's an internal os, what a surprise, there's an external os. And that will be the vaginal opening into the uterus. In between is the cervical canal. The cervical canal is usually where they take cervical tissue for pap smears, or the surrounding tissue surrounding the external os. I would know that bit about pap smears if I were you, because they're important for female reproductive health, not just, I should say female health, not just female reproductive health. Vagina is actually acidic. We have run into acidity in various parts of the body before. And yes, the acidity, which I think in the vagina is around 4.5, is there so you can prevent pathogens from invasion. We know that acid is going to denature proteins, and we know when you denature proteins, you change the structure to change the function. Officially, the vagina is a passageway from the cervix to the great outside. What does it do? It receives the birth penis. It's going to move uterine secretions, and it'll also be the canal through which the baby moves during birth. A membrane, which is a combo of epithelial and connective tissues, may partially close the vaginal orifice. Not all women have them. It is a natural variant to not have one and develop without one. So natural variant, or I should say normal variant. Some people have them, some women have them, and some do not. The labia are going to be these folds of tissue that are going to help protect everything that lies underneath or deep to them. The vestibule of the vulva is going to be enclosed by the labia minora. Clitoris is the corresponding structure to the male penis. It is an external excitatory structure. The nerve receptors and endings per square centimeter on the clitoris are greater than that of a male's penis. It also has 2 columns of erectile tissue, or I should say it is composed of 2 columns of erectile tissue. Mammary glands are all about providing nourishment for your developing infant. Lactation is going to be controlled by various hormones released by both the reproductive system and the placenta. We know that they will be located over superficial to the pectoralis major muscle. They are mostly fat. The areola is the pigmented skin that's going to be around the nipple. We have suspensory ligaments of the breast, which are going to be dense connective tissue bands that help support breasts. They will also form partitions in between lobes and lobules surrounding the ductal system. The glandular tissue itself is going to be divided into lobes, and each of those lobes will have a number of secretory lobules, and each lobule is going to be composed of what are known as secretory alveoli. Those glandular alveoli will produce milk. That milk will move into what are known as lactiferous ducts and then into lactiferous sinuses. And those will open at the nipple to the great outside. If you are non-nursing, those glandular structures are relatively undeveloped. Breast size is due to the amount of fat deposits that are in your breasts. For those of you who like images, there they are. Here's a list of videos that you are required to watch. Endometriosis. And again, I love all of the videos done by the Institute of Human Anatomy. You need to know the signs, the early signs of breast cancer. So watch that. And you also need to know the causes, types, symptoms, and some of the treatment options for each type. So watch that. Yes, you are on your own. You also need to know what prostate cancer is. Fun fact. The older you are, the slower prostate cancer will grow. So think about that. As you age, your repair and your growth and repair processes slow down. So cells do not replicate as quickly as they would if you were a whippersnapper, a youngster. So an 80-year-old man who gets prostate cancer is at far less threat of having that prostate cancer grow and metastasize than a male who is 20 or 22.